First off, I'd like to welcome to our regular meeting of the Health, Education, and Neighborhood Council Committee. It is Tuesday, April 10th at 2:15, and we are in City Hall, room 1010. First, I'd like to apologize for our delay in our meeting. We had some quorum issues, but we will be having full quorum as soon as our council members come back from Embrace LA luncheon series. We don't yet have a quorum, but I want to remind everybody in the audience that if you want to speak on anything on the agenda or general public comment, please fill out a comment card and submit it to the officer in the front of the room. And I'd like to open it up with public comment, general public comment, and we have there. Oh, John Lee. Is there John Lee? John Lee? No? Huh. Is there anyone else who wants to speak on public comment? Okay, well, public comment is now closed since we have no other public comment. So I am going to start the meeting. I know our members will be joining us in the next couple of minutes. But I'd like to start today's meeting with item number 1, which relates to the audit on Department of Disability. Mr. CLA, can you read number 1?
Sure. Item number 1 is the City Controller report relative to the audit of the Department on Disability.
Thank you, Mr. Powell. And could the Controller's Office come on up to the table and give us a presentation of the audit, please?
Cynthia Varela. I am Chief Internal Auditor with the Controller's Audit Services Division. And I'm here to give a brief presentation on an audit that was issued February 28th, 2018 on the Department of Disability. The Controller initiated this review to help the Department on Disability with an evaluation of its operations to assist in its efforts and be the most effective in carrying out its varied responsibilities. The Controller's Office found that the expectations for DoD are broad and that over time the Department's efforts have expanded or contracted based on demands from city leaders, other city departments, and the public, rather than based on a strategic plan. Given the limitations in terms of funding, personnel, and other resources, we reviewed the Department's functions through the lens of adherence to federal and state law and the city's prescribed expectations. We sought to identify the city's needs and risks so that policymakers can consider what DoD must do and what it should or could do. The key issues from the audit can be summarized in the 4 following areas. The city's expectations for the Department on Disability need to be aligned with clearly defined priorities and resources. Number 2, the department must focus on facilitating and supporting the city's compliance with the Americans with Disabilities Act, otherwise known as the ADA. Number 3, DoD is challenged in providing impactful outreach services in its efforts related to job placement and training for persons with disabilities and in seeking grants. And then lastly, number 4, opportunities exist to improve DoD's internal operations regarding the city's Blue Curb program, contract administration for interpretation and translation service contracts, and proposing a plan for prioritizing and allocating specially collected business tax revenue intended for ADA assessments. I'm happy to answer any additional questions the committee members may have about these and other findings from the report.
Thank you. And I do have some questions, but actually, could I get the Department of Disability to come on up and give an update on your response to the audit? How are you, sir?
Absolutely good. Thank you. How are you today, Mr. Chair?
Good. If you could state your names for the record.
Stephen Simon, Executive Director, Department on Disability.
Lourdes Sinibaldi, Director of Committee Outreach, Referrals, and Education.
So a couple things. Certainly want to thank the Controller's Audit Services Division. You know, an audit is something I think that's a stressful process for most folks. But I'll tell you what I told them day one. I really welcomed the audit because, one, we could use objective, thorough eyes on our work and make recommendations how we can be more effective and more efficient. And quite frankly, I imagined that a great deal of what the conclusions in the audit would be consistent with some of the things we were working on already, some of those gaps and deficiencies we recognized. And ultimately, I think that was the case. So I wanted to say a couple things, sort of a quick opening, and then address each of those 4 points briefly, if I may. One, I wanted to highlight that this department was in the mayor's office originally, right? 1975, Mayor Bradley created in response to the 1973 Rehabilitation Act. The act was pretty broad: equal access to all programs, services, activities, and facilities for people with disabilities for any entity receiving federal money. 1990, the ADA comes by. Basically the same rules, a lot more details, but regardless of whether you got federal money, Title II requires a local city or county, or a state for that matter, to again provide that same equal access to programs, services, activities, and facilities, period. Right? There really aren't gaps to that. So I know a lot of this analysis has been based on what we could do with the admin code about the department's roles and responsibilities, but over and above that, federal law absolutely requires that we ensure that level of accessibility. So where I want to go with that is, every city employee has a responsibility for making sure their work is accessible, quite frankly. But DOD is the only entity who has the overarching expertise and ability to coordinate that impact. So that said, a couple more highlights. We have 22 people to reach that mandate. Under the Bradley administration, to be honest with you, we had a little more than 40. We are really trying to work on a very tight and conservative shoestring, but consistent with, I think, the audit's findings, there is no question that DOD lacks, I'm trying to think of their exact language, bottom line, has a gap in resources to fulfill our primary mission. And that is something I would like to work with council and the mayor's office on. When we assess and prioritize the work we do, I can tell you it's hard for me to put on the table the notion of cutting back services to the disability communities we serve. The bottom line is we need to expand services, and we need to do so in partner with other departments, and partner with county and the state and federal governments and community organizations. When I look at that gap in regulatory authority, that's probably as important in the gap of resources. It's not always about dollars. We have no authority to enforce any accessibility guidelines with any department in this city. And I think that's something that needs to be revisited. I don't have an answer of language on how to do that. I don't understand the admin code well enough, to be honest with you, to make those recommendations directly. But I'd love to work with council and the CLA and the controller's office to really consider what some of our options are to have honestly some type of enforcement power. That said, enhancing our capacity to provide technical assistance to other city departments. I will tell you, and if you have questions afterward, Lourdes can give you a lot more detail on it. We have dramatically expanded our training for city employees, whether we've done so digitally. Council mandated our Title II training be taken by all city employees, which is a wonderful, wonderful thing. We've expanded our technical training and expertise for our own staff. I'll tell you that's been a budget problem. Again, that it's been recommended that those funds that we have get cut out of the budget. That was not part of the controller's recommendation. It's very important that we have the ability to keep my staff very highly trained. The third section, as the controller mentioned, was enhancing our ability to address prescribed responsibilities. What a lot of that had to do with is certain functions like job placement. Shouldn't EWDD be the city's lead on that? Yes, we agree. But there should also be a formal partnership between DOD and EWDD that maybe gets managed to a certain extent through council action to ensure that we make sure we're fully accessible in those programs. Same with the Blue Curb program. Yes, it's a DOT administrative function for the most part, but DOD needs to have some formal role. We generally don't have the resources to do the administrative work for those functions and would love for, quite frankly, bigger departments to sort of take a bigger chunk of that process. Looking at the final section of the audit, the improving our operational effectiveness, part of that was recognizing the need, let's see, I think my short version of describing this is almost all of my staff that takes even formal Title II federal ADA complaints goes into some Google Doc or Excel spreadsheet that they keep on their own computer, and that's how we track our cases and work with the public. It's 1980s tech. It's not okay. The department needs to operate with law firm level technology to case manage our clients, as a risk management protection for the city. I don't mind finding a way to do that in partnership with ITA and create that in-house. Council had a version of that you all use. I think is getting merged into 311 at some point, but it's got to be a formal priority for DoD to have access to really functional case management software to manage our work. Two other highlights under that section. The controller referenced the business tax revenue. There's already been an action that council approved through the last FSR, asking an ordinance to be drafted by the city attorney in collaboration with Building and Safety and our department. It looks like the way the law was drafted, it really is intended for Building and Safety to administer those funds, and DoD supports that. DoD supports Building and Safety using some of those funds to train its inspectors to be certified access specialists. That's an excellent use of those funds, but we do hope that some of those funds can be allocated still through the budget process or other council action to ensure that Department of Disability can essentially fund a pool of contracted certified access specialists to help administer the city's self-evaluation and transition plan. That's going to be absolutely necessary for us rethinking making this city a modern, accessible city. That said, I look at your, I suppose, draft motion on this item. Reporting back with recommendations to prioritize our responsibilities. Lourdes is managing a community engagement program. Again, she can give you any detail you'd like on that. We're very excited about really reaching out to the community on ways that we haven't in many, many years. And that will include talking to council offices, other stakeholders, and other comparable departments across the nation. There's a recommendation that we consider additional appropriations or administrative transfers of DoD programs. Again, I don't know there's a formal program to formally transfer to another department, but I think efficiencies and other ways to formally partner with other city departments is definitely in the making. Expanding our role in monitoring and mitigating risks related to citywide ADA compliance. That's a huge need. We are not formally engaged with the process with city attorney or CAO or anyone else around addressing potential lawsuits against the city around accessibility. And there should be a formal process that DoD is involved in. And I believe it can save us literally hundreds of millions of dollars in the long run. And again, certainly as we redefine our priorities, we will develop a strategic plan and get that to council as soon as possible. My last note would be we have developed a response to all of the controller's recommendations. They had a draft version or an early version in their formal audit release. We continue to update, and we will probably, I guess we have to work out the details, report back to them and/or council at least quarterly, certainly twice a year, minimally, to keep that updated. We actually have our first report is being sewn together right now.
Thank you, Mr. Simon. And, I do have a couple of questions, but I just want to first state that I know the controller's audit had a couple of concerns and a lot of recommendations, but at the same time, I got to commend to you and your department with the whole entire staff of 22, the yeoman's work that your department does, because as you briefly stated in your introduction, you're literally a hodgepodge of different departments. And whenever state or the feds pass some sort of new law or regulation, it often comes to your division, and you got to kind of piece it together and make it work. So I really appreciate what you've done to stretch your limited resources to address a multitude of issues. Because I know, maybe you can mention all the different divisions, if we want to call it, in your department, because I know there's the Blue Curb, there's accessibility issues, there's Office of AIDS, and in many cases, you're always coordinating with our brothers and sisters in the county side, who has a lot more resources and a lot more staff, and it's always augmenting as well as filling the little gaps or the holes. So maybe can you go overview with all the different, in your mind, the different divisions?
Absolutely. The way the DoD is structured, it's into 4 key divisions. Of course, there's our administrative divisions, very small. It's sort of our budget and dollar team, which is really 2 people for the most part in the front desk. But the 3 policy divisions you're most concerned about are the Americans with Disability Act team, our ADA team, that's guided by an acting ADA coordinator for the city now, Jeffrey Straneri. He couldn't join us today. He's got a sick kid at home and then had to go back home. But he is an extraordinary expert in sort of physical and technical disability issues, and has brought a huge improvement, I think, to how DOD works with other departments on the physical plan. So everything from the sidewalks to blue curbs, to go and measuring park space, to measuring bathrooms, to making sure City Hall elevators are accessible. That's what he does. He's doing it on site. We're doing far more than we have in a long time. He's got 5 employees that report directly to him with various levels of expertise, some in Title I, which is the personnel and city employment side, which is a big piece that we don't do a lot of work in yet, that I will be recommending to council that we take a deeper dive in, making sure that employees with disabilities have their needs addressed, and doing a lot of proactive work to avoid people going out on disability leaves. That's our ADA side. Our community outreach team, or my director, sitting to my right here. Do you want to do the few lines on CORE so I don't keep babbling?
No, you can go ahead.
Keep going? Okay. I think I talked too much on it. CORE, Loris has been with us 2 years next week and has done extraordinary work. It was sort of our intake and referral program. One thing I want to stress about that, because it did get discussed a bit in the audit, the county's got County 211. You can call up the county and get a referral to a service no matter who you are. County 211 calls us when they got a person with disabilities to say, can you, handhold this a little more in depth, because we really know the services that are available, and again, make sure people get walked through the process. So they do that kind of intake and referral, people with disabilities, their families, caregivers. They do all our special events, the Abilities Expo, Deaf Festival, all the work that the city does to partner with community organizations. Our technical accessibility team is part of her team. So all the work, every single city department, I think every council office too, got a letter recently that we will be meeting with the staff of every single department, their webmasters, their ADA coordinators, their emergency preparedness coordinators, to make sure all their digital documents and websites are fully accessible. That, I think, is the biggest lawsuit on the horizon, and we're going to be ahead of the game. Both the city of New York and Harvard and MIT are having trouble with that legal issue right now, and again, we're going to be ahead of the game on that one. The AIDS Coordinator's Office also is a key division, again, created by Mayor Bradley, and has had an extraordinary role. It sort of is the little brother to the county's massive AIDS program. The city's AIDS coordinator chairs the County HIV Commission, I will point out, and does extraordinary work partnering with our state, federal, and county entities to fill those gaps, like the syringe exchange work we do, a lot of work with transgender community and other hard-to-reach populations.
Great. And how many commissions do you guys oversee or support?
So we have one commission that we support. It's the Commission on Disability. It is a volunteer advisory unpaid commission of 9 members of community experts. Disproportionately our lawyers at this point really work on legal issues around accessibility.
Great. And, going to accessibility complaints, are city departments required to notify your department if they receive an accessibility complaint or otherwise identify a barrier for people with disabilities? And how do they do that, if they are to?
Short answer is actually no. There's no formal requirement to do that. We would love for there to be. We do think, quite frankly, we were part of what I think is a problem, a flawed policy, which was we and other departments would treat things not as formal complaints when they first came in. And I think we actually need to treat them as formal complaints, because we could treat it as a formal complaint, get in a formal federal timeline for remedying it, and remedy most of them if we took action in a quick and organized manner. And I think in the long run, the city would have a lot of risk management protection. But right now, there's no notification requirement. Formal complaints go into the city attorney's office directly. But otherwise, when city departments receive a complaint, they would generally go there. Some, if the staff knows my staff, will call us up. And often constituents know to call us directly, but it's not consistent in the messaging from the city.
So in that same line of questioning, what authority does DOD have to ensure that the city programs, services, or facilities are accessibility compliant?
You ask me the hard questions. I really have simple answers that I keep making long. The answer to that is none. We have no technical authority to do so. Most of the folks around the Horseshoe know me here. I'm not sort of a power guy. The reality is, however, that DOD needs to have, I don't know if oversight is the right word, because I think it's going to bug my fellow GMs, but we need to have some administrative, organized, functional manner of knowing when projects are even on the drawing board so we can make them accessible. And DOD, or whether it's a complaint, but DOD needs to know and be involved from day one.
So what can the department do to most effectively expand its role of determining or maintaining the accessibility of the ongoing city programs and facilities? Do you have any ideas? In the audience, can we tone it down in the audience? Thank you. Go ahead, Mr. Simon.
Sure. Council, coming out of this committee, did the biggest starter for ensuring we really change how we move forward in the future on dealing with accessibility, which was when you required city departments to go look at their 2000 self-evaluation and transition plan and call for us to update them. So we will begin that process. We're expecting, again, about a 3-year process to get from beginning to end on that. The very specific ask, however, we do have a part of our budget ask that's currently being entertained by council, is to create, it's what I referenced briefly before, a certified access specialist pool. These would be contract employees. It's hard to find them to make them full-time employees anyway. It's hard to get the exemptions, certainly, but we could create a pool of CASPs. I think we asked for, quite frankly, $271,000. We have the very specific math on how many hours that is per person. But those are the folks that, under the city's ADA compliance officer, would help go out and literally go out to 400 rec and park sites, literally, go to every library, literally look at the space, report it back into our coordinator, and help us work with the other departments. Doing that self-evaluation transition plan, I'll be frank again, I hear the whispers. Folks are nervous about it. Isn't it going to set up the city for liability? Isn't it a risk management problem to admit where our gaps are? No, it's not, because you know what? People with disabilities know where those gaps are. They find out, and when they're fed up enough, they sue us, and our answer is, oh, we didn't get there yet. It's not okay. If we do the self-evaluation and actually create a plan, even over a significant amount of time, like the sidewalks program, to address all the physical changes, that plan helps protect the city, and it helps speed up getting the accessibility improvements made for the community. So it's a win-win. It's definitely a risk management plus, and I'm really hoping we move forward quickly and get some funding to create that CASP pool out of DOD.
I mean, that sounds good. And it seems like you're already starting to reevaluate your roles and responsibilities. But has the department also thought about, based on some of the controller's recommendations, whether some of your functions could be moved to other departments?
Absolutely. So we've already taken action on some of them. There's a report that's an informal draft right now over at the Chair of Transportation, for example, to look at blue curbs and look at the role of DOT versus the role of DOD and so on. So that's a recommendation that came specifically out of the controller's audit. We have unfortunately had to reschedule 3 times, but we're having a sit down with very senior folks at EWDD to really link up the funding and programs that they have for various people around job placement and training, and make sure people with disabilities are fully served. We'll be partnering with them soon, and again, defining the appropriate roles. And I think ultimately that type of recommendation is something we can apply to how we interact with many city departments. So we'll go above and beyond on that one.
Okay. So you mentioned, last question, you mentioned $271,000. So what budgetary recommendations besides that, or is that the only one, is the department asking in the context of the next 18-19 budget cycle to address the concerns raised in the audit?
We literally have one full-time staffer that we are asking for to support our ADA compliance officer that needs to be a certified access specialist. We asked for that one position that would be a permanent staff position. The CASP pool, which is a contract pool, which we expect to be high for about 3 years and then come down in cost after we've completed the plan. We did ask for funding to either purchase off the shelf and have customized a case management program. So whether, again, there's some way to officially partner with ITA to do that at no direct budget cost, I'm fine either way, but we need to have action on it quickly. The other core ones I'm missing, that's really, we don't ask for a lot. Look, I'm very conservative about my budget asks. These are key ones. And again, there's literally $20,000 of training. It gets called travel, which always makes everyone nervous. That's because sometimes I have to send my folks to San Diego or Sacramento for a training. Generally, it's no further than that. But almost, I have the largest percentage of exempt employees in the city of any department because all of my employees have an extremely high level of expertise. And for years, they had not been receiving new training, quite frankly, before I got here. And they need it. They need to stay up to date. They need to stay in touch with DOJ when it can be off the record and be working with the folks who just make the rules around accessibility. And that's what that training money is for.
Thank you. And, and we'll definitely follow up with you and come to our office regarding those budgetary requests so we could get them filled. And question for the controller. If you could give us a quick overview of the 14 recommendations contained in the audit that are in process.
Okay. There were actually 16 recommendations that were directed to DOD. Of the 14, actually, all of them are in progress. Two of the 16 recommendations really require further
City Council.
action by City Council so that they
So that was my next question, so you could go over all 16.
So if we're going to look at the recommendations, in the two that require City Council actions, what needs to take place is Council should, one of the recommendations to DOD is that they should instruct the departmental ADA coordinators to report any issues, inquiries, et cetera, that relate to any ADA-related issues, that they should be reported to DOD. That requires Council to instruct departments and require them to report any and all ADA-related issues to the Department on Disability. The second recommendation that is still waiting for Council to act on deals with determining DOD's priorities and services. That's one of our main recommendations. Once that is decided, then DOD can take further action on the recommendation directed to them about prioritizing the core unit, their community outreach and resource.
Referrals and education.
Thank you. Unit functions and activities, but that all is predicated upon defining what the true priorities for the entire department are. The rest of the recommendations that are directed to the department deal with working with stakeholders to identify the organizational priorities, as Mr. Simon has mentioned that they're already working on that, and that's to provide some information to policymakers so you can decide what it is that you would like them to prioritize as far as the prescribed responsibilities. Enhancing their role with ensuring ADA compliance and defining their capabilities with technical assistance related to risk management that's associated with ADA compliance. That deals with the self-evaluation and transition plans and monitoring those. Implementing more formalized systems and training for providing departments with technical assistance. Redefining its roles and responsibilities, as I mentioned, with the departmental ADA coordinators, re-examining some of their administrative processes, looking at having a project management system that will better define and track their performance outcomes and measurements, looking how they can better seek grant funding, and then working with other departments as far as looking at, with EWDD, looking at providing job training, and job placement opportunities for individuals with disabilities. And then lastly, administering the interpretation and translation service contracts. It's kind of it in a nutshell as to what those recommendations are, and the department has taken some actions to implement those recommendations.
Great, thank you. And let the record reflect that Council President Herb Weston joined us a little while ago. And but before, I have some instructions, but Mr. Weston, do you have any concerns? Yeah, they did a great report here. So there are no public comments, public speakers on this item. So I'd like to move this report and approve the City Controller's report and recommendations. But I'd also like to add 2 additional instructions. And it would be to therefore move that the Chief Legislative Analyst and the Chief Administrative Officer, with the assistance of the Department of Disability, be instructed to evaluate the department's prescribed responsibilities as detailed in the LA Administrative Code and report back with recommendations to prioritize those responsibilities within the department and to recommend any additional appropriations or administrative transfers of Department of Disability programs to improve efficiency and effectiveness. This evaluation should also include recommendations to expand the department's role in monitoring and mitigating risks related to citywide ADA compliance. I further move that the City Council, that upon council adoption of a revised set of responsibilities, that Department of Disability be subsequently instructed to prepare and present to the council and mayor a strategic plan based on the department's revised priorities. So, so moved, and we will accept. Thank you. Thank you.
Thank you.
Appreciate that. So item number 2, Mr. CLA, could you please read that into the record, please?
Sure. Item number 2, Los Angeles Housing and Community Investment Department to report relative to the benefits of a child savings account program for the city with estimated program cost and coordination, account types, funding models, and legal considerations. This item is being scheduled pursuant to council action of March 7th, 2018.
Thank you, Mr. Powell, and thank you, Abby, and thank you, Aaron, for joining us. And before you present, I just wanted to briefly comment. Mr. Weston, this item is actually, if you can recall, 3 years ago when I first started on the council, you challenged me. You challenged me on education. You said, David, we need to do something as a city council on education. And this is what it is here, and I've taken that challenge wholeheartedly. I am very excited about what's before us today. It's going to be a robust discussion on how to improve graduation rates and college enrollment in Los Angeles and how to invest in the future of our city. You know, many of us were lucky to serve in City Hall, and we all owe it to someone else, whether it's a parent, a teacher, or a mentor, someone who believed us at an early age. Too many kids across the city do not have that person, and we know that there are too many kids who are smart enough, resourceful enough, and who deserve a chance at a better future, but still don't see the higher education as a possibility. We have a chance here today to take a long view of our students' futures and to talk about what kind of city we want to build going forward. Every year, the share of jobs requiring a college degree goes up, more than doubling in the past 30 years. Yet today, children from high-income families are 8 times more likely to get a bachelor's degree than from kids from low-income families. But if a low-income child does go to college, he or she is more than twice as likely to climb out of the bottom rungs of the ladder. Studies have shown that children begin to formulate ideas about their future as early as elementary school, and a low and moderate income child with a college savings account from $1 to $499 is 3 times more likely to enroll and 4 times more likely to graduate from college than a child without a savings account. We face a litany of challenges today in the city, from homelessness, poverty, income inequality, and a changing economy. Investing in education and in the future of our kids can break that cycle on a number of these issues. I'm looking forward to more discussion in this area, and with that, I'd like to turn it over to Aaron from Prosperity Now to tell us what that would look like.
Before we ask Aaron to give us an overview of the report, I just wanted to say, Councilman Ryu, that we appreciate your passion and your leadership on this issue. Councilmember Wesson, if you recall, Councilmember Ryu, through the support of the council, you did instruct HSID to issue a request for proposals to identify a partner that has expertise in the development and implementation of children's savings accounts. We were fortunate to bring on board Prosperity Now, who is a leader nationwide in working with a number of municipalities to implement this type of program and other similar initiatives. We were just talking about, what's next, where we're looking at an emergency savings program that has also been implemented in other cities across the country. I am fortunate to serve as one of the city representatives on a coalition of cities, the Cities for Financial Empowerment, that includes 14 cities from across the country that are looking at municipal financial empowerment initiatives. Cities like New York and San Francisco and Seattle and Boston are all part of this network. And I can personally attest to the work that they're doing in their local cities. Many of them have a children's savings account program that has been implemented and now successfully being offered to a number of kindergarten students in those cities, and some now statewide initiatives. So we're really excited about this partnership and this initiative. I'll turn it over to Aaron to walk us through the overview of the report, and we're happy to answer any questions.
Thank you, council members, for having me today. My name is Erin Thiemann. I'm a consultant with Prosperity Now, and I have been tasked with helping the City of Los Angeles get a children's savings account initiative off the ground, which is very unique for Prosperity Now. We've worked with, since 1979, on technical assistance and policy advocacy in a number of areas related to asset building. So that includes things like affordable home ownership, financial capability, and children's savings accounts. So we've worked in a number of cities and states to help get children's savings initiatives off the ground. And I just want to preface by saying we use acronyms a lot, and I will say CSA probably another dozen times throughout my commentary, and that does not stand for Community Supported Agriculture, though that's an important program. CSA in this case stands for Children's Savings Accounts. And it means a lot of things, and we'll talk about the benefits and program structures that other municipalities have used. But Prosperity Now has been instrumental in getting programs launched successfully in places like New York, San Francisco, St. Louis, where I've worked for the past 3 years, getting the program off the ground through its first years of implementation, as well as statewide efforts in 6 states in New England, including Maine, New Hampshire, Rhode Island, and the state of Nevada. So we've been working on children's savings accounts for a number of years and have learned a lot along the way. So armed with those lessons and best practices, and because Los Angeles is a city unlike any other, we're here full-time to help work through challenges and potential pitfalls and design a program that really meets the needs of Los Angeles. So as Councilmember Ryu alluded to, national data are really telling a story of a diminishing return on a high school degree. Bachelor's degree holders earn 83% more now, and we've seen a doubling of jobs requiring credentials beyond a high school diploma. In LAUSD, only about 72% of students are graduating from high school, and even fewer are venturing on to college. And when we talk about children's savings initiatives, I will use the word college as a stand-in for post-secondary education because it's quicker to say. So when I say college, I want you to think about all of the post-secondary options that Angelenos have, which includes 2-year, 4-year community college, public, private, in-state, out-of-state, any credential or training program or vocational training. So I'm going to use college as a stand-in, but know that I mean more than just a traditional 4-year college. So in Los Angeles, only 32% of residents have a bachelor's degree. So that means the city is missing out on potential job opportunities, and more importantly, for a city that relies on tax revenue to fund lots of programs, we're missing out on tax revenue from an educated workforce. If the city of Los Angeles expanded its number of college graduates by just 10%, we could potentially see hundreds of millions of dollars coming to the city on an annual basis, both in higher taxes paid to the local and state level, as well as increased consumption and spending on things like sales tax. So why aren't families saving for college? If college is this great equalizer and we see that students are going to earn more if they go to college, why aren't they saving? And nationally, we see that less than 3% of families have funds in a dedicated college savings account. So 3% is, there's not even 100 people in this room, so maybe 1 or 2 of you would be saving for college based on national data. And it's hard for families to save because of 3 major reasons. The first is a strain on today's budget, and Abby can speak more to that in her work with family support centers about just how hard it is for families to get through day to day and not have the ability to think about saving for their child several years down the line. The second is lack of access. We've seen mainstream financial institutions have not stepped in to provide accounts that work for all families, especially families that may lack a social security number or ITIN. And the final thing with which the council member already alluded to is college expectations. I used to teach 4th grade, and what I found is that kids are taking themselves out of the running because they know they don't have money for college. And really academically gifted kids are deciding from a young age that college is not for them because they know that their families can't afford it. So instituting a college savings program helps mitigate that wilt or that experience of academically talented students thinking that college isn't for them. So that's why we're working with HSID, and we're really excited to be working with LA Unified School District. We've been working with Board Member Melvoin on designing a program that makes sense for the City of Los Angeles. Like I said, a number of cities and states have already begun introducing these programs. So if you want examples, there's a really great program in San Francisco that was started by Treasurer Jose Cisneros a number of years ago. Their first kids are now in 8th grade, so they're getting ready to make that journey to high school. It's one of the oldest CSA programs in the country that's citywide. And CSA programs differ from ordinary savings accounts and differ from scholarships in that they often provide financial education, college preparation or academic support, and a concrete reminder of college expectations. This is about getting the idea of college and access to savings in front of families early. I can tell you that as one of 4 kids, my parents, as much as they wanted to save, did not start saving early enough, and I'm sure that rings true for many of you here in this room. So that's why children's savings accounts, instead of we're starting with kids that are very young in their earliest years of elementary school, because if we started with high school students, they may be more excited about college because it's closer, but we know that low-income families need as much time as possible given the rising cost of college. So that's why we focus on the children and children's savings account initiatives. So what we're really trying to do here is help expand the pipeline of students that are considering higher education. Children, low to moderate income children with college savings and less than $500 in college savings are 3 times more likely to enroll in college and 4 times more likely to graduate. And that's holding every other factor constant. That includes income, that includes race, that includes even scholarship levels. So the one thing that's different is that college savings account. So we're really here to try to expand that pipeline and increase that 3% of families that are saving nationally for college to 100%, which they've successfully accomplished in cities like San Francisco, St. Louis, and New York is on its way with a pilot program in Queens. So we're here to help design that platform that will hopefully be a public-private partnership. Most of these programs have both public and private funds from philanthropy from the municipality running the program, and of course contributions in the form of deposits and savings from families. So that includes not just mom and dad, but mom, dad, grandma, auntie, uncle, anybody that wants to help save your child for college. So there is a report that's been transmitted by HSID. It's very lengthy if you have the time to sit down and read it if you want any more details. But we're already starting to see in the field some promising results. The program in San Francisco that I mentioned, their oldest students, their 8th graders, were 24% more likely to see themselves going to college than students who were just a year ahead of them, so that control group. So we're seeing an increase in college expectations, and students were also 32% more likely to know about financial aid options, which if you've ever explored the college application process, it can be a daunting experience in and of itself. So we're also seeing that saving for college is having some impact on preparation for post-secondary, which is very exciting. So what we're here to do in Los Angeles is to create a program that serves all kids. So that means universal eligibility. Families are not going to be excluded based on income. At least that's what we've found to be a best practice across the country. And we want to work with a financial institution that provides an account that works for all families, and I can get into more detail about what that means. And we want to provide additional supports to students who need it most. LA is unique in that it's the 2nd largest school district in the country, so we're working closely with LAUSD to design an incentive and support functions that provide extra contributions and extra programming to students that need it the most. And really what we're here to do is to create opportunity for students and to create access for students who've been excluded both from the financial mainstream and from that college access pipeline. So with that, I will turn it to the council members if you have any additional questions or would like me to provide clarification on any of the statements that I've made.
No, I have no questions, but I do have a comment. Yes.
First of all, I do remember the conversation that, Mr. Chairman, you and I had when you first got here, and we talked about doing something in the field of education, and I have to say that this is really pretty impressive. And to you guys, I have to say, not only was it a thorough report, it was kind of like easy listening, you know, so it was just really straight and to the point. But a couple of things just kind of, I don't know if I can wrap my head around it. Maybe I'm just stupid, or as a kid, I don't know, but did I hear you say that kids by the 3rd or 4th grade figured there was going to be unlikely that they would go to college, and they kind of, I mean, when I was in the 3rd grade, I was just thinking about Saturdays.
Right.
So I could watch the cartoons. That's frightening.
It really
To
is.
me, that a third, how old would that be? It's 9?
Yeah, 9 or 10.
That they're worried about that.
Yes, absolutely. Yeah, there's been a lot of research in social and emotional development, specifically on college expectations. And what they've found is that at birth, 100% of moms think that their baby's going to college, expect their child to go to college. 100% of moms at birth.
Really?
Yes, 100%. Every mom, when their baby is born, says, my baby's going to college, I know it for sure. By 3rd grade, we start to see those expectations for low-income families drop by about half. Which is really far away from college. We're starting to see these expectations really set in before middle school even starts. And part of it is due to the runaway costs of college, and we've found that kids that have higher college expectations, unsurprisingly, perform better in school. So one of the programs in Indiana, that's in 13 counties in Indiana, so rural and urban and suburban, everything in between, they found that kids who are participating in the college savings program have higher performance in math, higher performance in reading, and higher attendance in school. And if you think about it intuitively, in the same way that an adult who's saving for a down payment on a house is more likely to buy a house than someone who's not saving at all, right? Because when you set that goal and when it's top of mind, you're more likely to execute on what that goal is. So that's really kind of what we're trying to replicate in this college savings space, is keeping it top of mind for families. And I worked on the program in St. Louis for several years, and I cannot tell you how many conversations I've had with moms, dads, and grandmas who said, it means so much to me that the city thinks my kid can go to college, because I wasn't so sure. But now we have this account, it has some money in it, and in St. Louis the program was funded by parking meters, so that also helped, that families were saying, I feel a little bit better about, paying my taxes, paying my parking ticket, because it's going to benefit kids in our city. And I think that's one of the features that makes this such a unique program, is that people feel good about paying their taxes and about paying fines if they know that it's benefiting their community. And this is a really great opportunity for the city to invest in public education, because they're separate systems and the city doesn't always have control over what the school district is doing. But this is an opportunity for the city to invest in its future workforce.
And the last thing, Mr. Chairman, that I found interesting was when you talked about those that do have the college education, that they make 80+% more, and then if we just increased the number of Angelenos that had the degree, we would generate more, income tax and things of that nature. And all of that makes sense to me, but I'm just curious, if we had the jobs, wouldn't we have more college students wanting to move to Los Angeles? I'm just, so I'm just a little, I just wondered how did you put all of that together? I mean, if we had higher paying jobs in this region for college students, I don't think we would have a problem in attracting, not college students, college graduates. I don't think we'd have a problem in attracting college graduates. So I do think that one is needs to be a little more tightened up for me to understand that. But I'm impressed, but that I'm not quite connecting.
Yeah, absolutely. And that's a really great question. And I think part of it is that it's hard to tell a 15-year-old that if you go to college that there's going to be this high-paying job for you and that companies are going to, line up to employ you. But I think what we need to focus on right now is actually building the pipeline and building the workforce. I think we're almost too early to say that, employers are going to see the city of LA as a place, with enough college graduates to even fill the jobs. I think right now we're even at that earlier stage where we need to get focused.
So if we had more graduates, you think that would help us attract businesses because they could come here and find okay, now you...
Yeah,
see,
absolutely.
I'm old and slow, but I get that.
Councilman, we can provide you with additional detail, but what we are hearing from employers, and there is some research, we've worked with the National League of Cities and others, that indicate that most of the jobs are for college grads, and we're not able to fill those jobs because we don't have enough college grads in the city.
I would love to see whatever
Yes.
data that
we're happy to provide you with some additional detail.
Yeah, Mr. Wesson, and one of the larger employers, whenever they try to pick a city for their headquarters, a college graduate economic workforce is a huge component. But here in LA, we don't even need the jobs. People are coming here anyways. So just by our mere weather alone, we have no problem with immigration. But I just want to echo with everything that's being said here, and and I can personally attest to the power of suggestion. When I was growing up, I was supposed to be a doctor, and my parents told me I had to be a doctor, and that was the only thing I can be. So, and it was assumed that I was going to go to college. So even at an early age, I knew I had to go to college. But, just to echo to what you were saying, Council President, as a little child in elementary school, I knew I had to become a doctor and go to college. But I had no idea. Growing up, my family was in lower income family, and we were living in a poverty area, and I knew we were poor. We lived in an apartment. We didn't own a house. And it dawned on me, how am I going to pay for college? And I thought, I think my parents want me to get a scholarship. That's crazy. And it was not only till I got into high school where I met with a guidance counselor who told me about Cal Grants. I got a few scholarships, very little, but Cal Grants, Stafford loans, Perkins loans, and because our state is so great and we have so many great programs, I was able to go to college. If it wasn't for those programs, I would have never been able to go. But my parents didn't even know about those programs. I found out about it later on. So just the mere fact, even as a young child, I knew I wanted to go, but I didn't know how to pay for it. So, and neither did my family. So this is great. We do have one speaker on the queue before we approve. And thank you so much for the presentation. If we could have Beverly Weiss come on up. Is Beverly here? Or did she leave? Beverly Weiss? Okay, seeing that she's not here and there is no other public comment cards on this item, I'd like to approve this report and with two instructions. First instruction is I'd like to instruct the HCID with the assistance of Prosperity Now to report in 45 days with a detailed program outline that includes, but is not limited to, details regarding account type, account seed money, account seed amount, participant eligibility requirements, account structure, account custodianship, accessibility, incentive structure, and program implementation. 2, instruct HCID, the CLA, and the CAO to report in 45 days with the recommendations regarding the oversight and administration of a children's savings account program, appropriate staffing levels, and funding for program implementation and administration. So if I could. So moved, and it has been approved. And with no other business before us today, this meeting is adjourned. Thank you to all the departments and concerned citizens who joined us here today. Thank you.
Thank you, Mr. Chair.
Thank you.